let's take a look at the anatomy of a knee. Zoom in, and we'll check out that there's really 4 bones that make up your knee. There's your femur, your patella, your tibia, and your fibula. So 4 bones that make up the joint of the knee. And let's add the ligaments. Yeah, here we go. The ligaments that make up your knee. Okay, so there are these things called joint capsules, which basically is the casing for the joint itself. You have, let's get rid of that one. Here we go. Your meniscus, which let's see if we can get rid of this femur. We can look at this from above. Yeah, this is the best view ever. Okay. You have your lateral meniscus, lateral just meaning the one on the outside. You have your medial meniscus, which is the one on the inside. And then we have, let's go up. Let's get rid of this guy. Okay, and then you have all these cool little guys. You have your posterior meniscofemoral ligament. You have your posterior cruciate ligament. You have your anterior cruciate ligament, which is everybody's dreaded ACL. Right? And let's get rid of that patella again. Okay, so those are the big important structures that make up a knee. And the knee is described as, I saw a physician describe it once as the middle child of the body, meaning that it is in between your hip, it is in between your ankle, and it often gets blamed for a lot of trouble that it didn't cause, as most middle children, as I understand it, are. I'm the youngest, so I wouldn't know. So we start to look at some of the muscles around our knee. Okay, and you can see that there's not a ton of actual muscle activity at that joint, but there's a lot of connecting that happens around that joint. There's a lot of these tendons that the muscles connect to that help us move it. Okay, so it's often this like junction of muscles that cross our hip and our knee, and then muscles that cross our knee and our ankle. And that makes sense again from an evolutionary standpoint, that it lets us run and walk and climb and do things without being really restrictive. So I just like to show that for people. These are tendons. Your quad muscles are these 4 muscles through here. And they attach and they bend and straighten your knee. Your hamstring, which I often forget to show people on this, starts up here on top on your pelvis, right? So let's see. Can we? Oops. There we go. That's your ischium bone. That's your sit bone. And if you look closely, you can see that your hamstring muscles start on that sit bone. And they're kind of small and they're thin. And that's why when people tear a hamstring, it takes us a while to recover from it usually, because we're dealing with just a smaller, thinner muscle versus someone who's torn a glute, right? That's a big, thick, juicy muscle that gets a lot of blood flow. So it often heals a lot faster. So all of that to say, your hip and your knee are really closely related. So go check out the hip video if we're dealing with a knee problem with you, because there will be exercises that will work on to stabilize your hip in order to help your knee. I appreciate you. Thank you for spending your time and your attention with me today. Keep moving and keep getting better every day.